My name is Sean Thomas, and I'm the author of Be More Today, a 40-day guide to a better version of you. As doctor of physical therapy, I've seen thousands of people do great things. They came to me with ailments, physical ailments, pain, issues, and they got through them, all because they decided in their mind they were going to do it. And I guarantee you, if you just trust the process and be persistent, you too can be the best version of you. Have you ever been out and about, traveling, running, and you're trying to figure out how to hold everything on you? Phone, keys, wallet, lip gloss, lip balm, your gels. I got to tell you, the best belt you can ever use is by one company, and that company's name is Spy Belt. Spy Belt makes an innovative running belt that solves the pocketless problem. Whatever small personal items, SPI, need to be toted during physical activity, you will hold it in your very discreet, expandable running belt with comfort and ease over any distance. And those are the words taken right from Kim Overton, CEO and founder and inventor of the Spy Belt product. Kim's a great friend of mine. She sponsors the Be More Today show, and we support all things that Kim does. So if you're looking for the best belt on the market, visit spybelt.com today and check out all their amazing belts. I wear them for all my runs, and I think they are the best. If you go on today and use the code Be More Today, you can get 10% off any of their merchandise. So check out spybelt.com, and let's continue to be more today with Spybelt. Run smart, run free, run with Spybelt. Don't let aches and pains hold you back from living your life. At JAG Physical Therapy, our experienced clinicians create a personalized treatment plan that fit each and every patient's needs uniquely. Whether it's recovering from an injury or enhancing your performance, we've got you covered. With over 150 locations throughout New York, New Jersey, and Pennsylvania, there is sure to be a JAG Physical Therapy location near you. Visit jagpt.com and book an appointment today to get back the life you love. That's jagpt.com. JAGPT.com.
Welcome to the Be More Today show. Don't forget to like and subscribe to our show today. Now, let's hear it from our host, Dr. Sean Thomas.
What's going on, folks? Your boy again, Dr. Sean Thomas, back in the building with the Be More Today show. We are back in the building. Season 6 of the Be More Today show is here, folks. We're in the month of March, my favorite month of the year. You already know, March babies stand up. That means me. That means my daughter, Sonali. I love you so much. Happy birthday. And to all the March babies, I salute you so much. You already know Be More Today is a movement. And we've been doing this thing for the last 6 years now, bringing on great people doing great things in health and fitness. As always, BeMoreToday.com for my book, our More merch, and my second book, which just came out, Project More, out right now. So go out there and check it out. You will not be disappointed. Our next step challenge actually happens on April 1st. So if you want to be part of our challenge as well, go to BeMoreToday.com, click on Steps of Greatness Challenge, and join our challenge for April 1st. And as always, Be More Today's show is heard in so many places now, right now, heard in 90 different countries, over to 70,000 downloads. Again, thanks for your love and support. This show continues to grow and inspire others to be more today. So go on our sites, BeMoreToday.show.pt, and your boy here, Dr. Sean Thomas, for all things Be More Today related. Our sponsors, as always, want to say thank you to you, our Spy Belt sponsors, and our big sponsor, JAG Physical Therapy. You've been great in terms of supporting us from day one. We salute you. We support you as well. And I thought to myself, as we're all trying to be more alive in 25, what way to bring on the month of March am I bringing on the great leaders and champions in healthcare, our athletic trainers. Now, JAG Physical Therapy is my company, my job. I love it. They love me. I love them. It's been great working with them for so many years. We've had a number of ATs on the show for the last couple of years now. But I said to myself, as the theme for this year is champions in healthcare, what better way to bring on the ATs of JAG Physical Therapy? And I have so many ATs across so many spectrums here today. So without further ado, ladies and gentlemen, boys and girls, pets included, please welcome to the stage the great ATs, athletic trainers of JAG Physical Therapy, with our first guest being the director of AT at JAG, Stephanie Lashaibo. Stephanie, what is going on? How are you doing? Great to see you.
Yeah.
How are you?
Hi, Sean. Well, it's great to be back for another year, celebrating National Athletic Trainer Month in March with some of my awesome team members here. Again, just very excited to be back and, really get into it today with everyone.
Awesome. I appreciate you so much. Just tell
Yeah.
listeners again who you are,
Yeah.
what you do at JAG, and then we'll go down a list of the other guests we have on the show for today.
Absolutely. Yeah. So as Sean said, I'm Stephanie Lachavo. I'm the Director of Athletic Training here at JAG Physical Therapy. I've been, with the company for about 7 years now and, have seen this, department grow significantly, not only in the employees we have, but the settings we serve. So today I do have just a few of my awesome athletic trainers on, with, again, a variety of experience and a variety of settings. And I work with them each and every day. So it's again excited. I'm excited to be, be able to discuss the profession in this outlet with them today.
Awesome, awesome. Let's go
Yeah.
to Sophia first. Sophia, how you doing today?
Doing well. Excited to be here. Thank you for having us. So I am working through JAG. My site is at New Jersey City University. It's a great school. It's D3. So I help take care of the collegiate athletes with two other athletic trainers.
Awesome, awesome, awesome. And we have Amanda on the show. Amanda, how are you?
I'm good, Sean. Thank you for having me on. Like Sean said, I'm Amanda Morgandale. I'm the athletic trainer at Morrisville Middle Senior High School in Morrisville, Pennsylvania, where I'm also the athletic director. And I've been an athletic trainer for 15 years in the secondary school setting.
All right, congratulations on that.
Thank you.
My boy Roy in the Bronx. Roy, what's going on?
How you doing? Good morning, everyone. My name is Roy Flores. I am an athletic trainer in the Bronx at the secondary school, Mount St. Michael Academy. Before that, I've about 20 years in collegiate athletic training, and I've been in some leadership positions around New York as well.
Awesome, awesome, awesome. And last but not least, we have Kristen.
Hey everyone. Yeah, thanks for having me on. My name is Kristen, again, manager of athletic training. So I'm with Stephanie. We oversee, our athletic training department. We have a great department, 17 full-time athletic trainers all throughout different settings in athletic training. So I'm assisting, overseeing them and a lot of our per diem athletic trainers who do go and help all of our partner sites throughout New York, New Jersey, and Pennsylvania. So I've actually only been with JAG for a little over a year now. Most of my tenure is actually down south in Texas. So definitely excited to be back up on the East Coast, treating athletes on this side of the country again.
Awesome. Thank you guys so much for sharing that. And again, today's show is really focusing on athletic training and how you guys are really instrumental across the spectrum of so many fields. So the theme for this year is champions in healthcare. And I see you guys as champions. You do so many things. But we're going to focus on what you guys do today. And Sophie, I'm just curious, for those who may not know, what exactly is athletic training?
Right. So as athletic trainers, we're allied health professionals, and we work within a team, right? So the traditional setting, which is usually within athletics, we're able to work in our sports medicine team to deliver primary care, care in emergency scenarios, managing orthopedic injuries. In addition to managing and assessing the injuries, moving on to rehabilitation, we're also able to use our education in prevention, which is very important when we're outside during the summer, preventing serious illnesses such as heat stroke or in the colder weather, frostbite, and those type of scenarios.
Okay. Now,
Mhm.
for those who might not know exactly what you're talking about in terms of the um, demographics we're looking at, what are the age groups you're talking about when you talk about training exactly?
Yeah, so a variety. Again, with traditional athletics, we have secondary schools, high schools, college, professional type of population, usually, but then we also have non-traditional settings, which our other athletic trainers are able to work and operate within. It's a
Okay.
variety of ages.
Okay. And then for you, I mean, I'm always curious to ask people who just got into it or are recently into a new profession, what inspired you to get into this thing? What drove you to it? And how are you liking doing what you're doing?
Yeah, so I was very lucky to have athletic trainers when I was in high school. Even right now, as our profession grows, it can be difficult to have athletic trainers in the secondary setting or at high school settings, right? But I had a great relationship with my athletic trainer. And like many athletic trainers, when we learn about the profession, it's because we've had an injury or two, or seen our friends have an injury or two.
Mm-hmm.
And a lot of the time in athletics, your identity is tied to how you're performing, right? So you kind of lose a piece of yourself, that identity, that independence where you're able to perform, and you just care about how to take care of it and how to get back to 100% to do what you love. So being able to transition from an athlete to now athletic trainer, where I'm in the role when someone gets hurt, I'm able to take a look, let them know this is what's going on with your knee. Okay, it's okay. This is the next step. This is what you're going to do. You carry out the rehab, and then you're able to let someone know that they can still have their independence. It's just a different side of being an athlete, right? We're not always going to be 100% all of the time. Also, being an athlete or physically active, it's about taking those punches and being like, okay, what are the next steps? You facilitate that environment and you kind of give that independence back and say, you can still be challenged to be better. This is how you're going to help yourself heal. Because they're still putting in all that effort in rehab and return to play, which is
Mm-hmm.
mighty difficult. So you kind of give that power back in a debilitating time almost. Very
Yeah.
rewarding.
Yeah. I too was an athlete and I got into PT because I also got hurt. I'm just curious, how many of you also were athletes or are athletes? And that's kind of how you got into this thing as well. I think that's all of us. So there's definitely a common ground there. And I think that's really poignant. You being able to know what it was like being an athlete or you being an athlete now, and then giving that empathy, giving that compassion towards your athletes, towards your clients. It makes the whole thing come full circle. And again, it makes you really, like you said, invested in them getting better because you know what it's like mentally to have to get back out there and have the confidence to trust your body again. So those are all really good points. Amanda, I'm curious for you. I know you are in a variety of school systems, middle school and high school. How important is it to really have ATs in the school system? Because when I was in middle school, I didn't have athletic trainers. When I was in high school, we had two. And my school was a very big school, so there weren't enough ATs to go around with all the athletes we had. So I didn't really feel like I had any kind of real connection with them. But you're in the school system, we're digging with different age groups. What's it like, and how important is it to have ATs at that age group?
Oh my God, I think it's so important. This is my second school I've been at where I've worked both with middle school and the high school. Um, and not just because of the injury prevention that we were here for or the immediate care, the rehab if we have the time, or even the emergency preparedness. But I think the big thing of athletic trainers being in the middle school and the high school setting is just the education to the athletes and even the parents. I've noticed, especially with everything in the news with the heat illnesses, with concussions, everyone's kind of stuck. I want to say in the Stone Age where, oh, you have a concussion, you're not allowed to sleep, this and that. And I really think educating everybody on all the increased knowledge that we have in all these aspects of healthcare is huge because anytime, especially in middle school, I've talked to parents, they're like, oh, we'll go to the ER. No,
Mm-hmm.
you don't have to necessarily go to the ER right now. Like this is what the steps to take care of things. And I think that helps alleviate the ER and other doctors' offices as well. We're here to kind of step in and help guide everyone where they need to be.
Yeah, yeah. I mean, that's it's funny you mentioned ER. There's so many people, and I think that's a cultural thing too. Just our parents, maybe the parents even before them, have done things certain ways. So that's also shared with their kids. But like you said, educating them that yes, we are a resource. You guys are a resource for them to be able to go to and speak with them about certain things that you are very well versed in. No need to call ER or EMS to come in and do that right now. You guys are on site to do those things. And I'm curious, Amanda, you're talking about the injury prevention component. The kids today are learning much more than I learned when I was in middle school, right? When I was in the high school, right? Even in
Yeah.
college. So are you seeing that there is a correlation between high schoolers, the middle schoolers being more prepared, having less injuries, performing better either in sports or in competition compared to, the older demographics, or any correlation between that you've seen?
Yeah, I do see some, especially having the athletic trainer in the middle school. When they get to high school, they're more willing to see us if
Mm,
there is an issue going on. Technology and resources now are at everyone's hands, so they've done a lot more research. When it comes to any aspect of injuries with the mental health, that is a big thing this year. And, athletic trainers do so much, and there's so much that we do that people don't necessarily see.
Mm,
So, if they're comfortable seeing us, then throughout the years, they are just, we become like a second mom or dad to them in a
mm,
sense sometimes. So I've had athletes that are starting to learn their body with me throughout these past few years. So when something does happen, they're aware of what they need to do and see. I've had a few kids like throw out their hips a little bit. We've worked on, exercises and muscle energy techniques that they
mm,
know when something's like off, that they come in right away so it doesn't get worse and we have to send them anywhere else.
right.
Where like the older population, I think just try to tough it out. They didn't want to see the athletic trainers because we were going to take them out of sports. Where
Mm.
that's not true. We're not taking them out unless it's medically necessary.
Yeah, that's interesting. I do remember myself having that same mentality of getting hurt, not wanting to share that I was injured because I was just trying to get through it and hoping it would go away, and it just didn't go away. Um, but you mentioned the mental health component. I think that's really a strong component of that. Again, when I was in high school, when I was in college, we didn't have that, right? There was no one talking about our mental health when it came to anything. It was more like just like get ready for the game, get ready for the event, and the psyche about that was in it, but no, not in terms of how are you feeling? How's your body feeling? Are you aware with how your body is going through the changes? You mentioned changes, and middle and high school, that's a very, very interesting time for men
Yeah.
and women, boys and girls, because their body is changing. So none of those things I was exposed to, when I was younger. But the fact that you got to getting into that now, I'm just seeing that this generation of young people, which will be my daughter at some point in time, will have more resources to really make sure they can explore their bodies better, be more prepared for physical activities, potentially have less injuries. So it seems, right? And then just be a little more aware of body awareness and the importance of stretching and all these different things. I mean, we stretched when we were younger, but not really, right? I mean,
Yeah.
there are many times I'm sure where you say, well, I'll just see how it goes. But now that we're really talking about infusing these things into the school system, I think it will be better for our kids in the future. So you're in a great position to do that. And
Thank you.
Roy, I'm curious for you now in the Bronx, you have so much experience across all the spectrums. Um, Talk to us about the flexibility in this field because I've seen ATs everywhere, right? When it comes to high schools and colleges, various sports and whatever else. But there's so much flexibility that comes in this field now. Can you share some of the environments where ATs can be found making a difference?
Sure. So with athletic training, as Sophia mentioned earlier, a lot of it has to do with orthopedic stuff and just preparing the person, whether it's preventative teaching, education, or evaluation and preparation, right? So athletic trainers can jump from place to place. Traditional settings are the schools and the professional sports, but now we're found in doctors' clinics where we can help with orthopedic evaluations on that end. We are found in emerging settings, as they call it now, which we've been in for a while. So we might have to change the name of emerging settings.
Mm,
Maybe we're already established in those settings, but performing arts, right? So they see themselves as athletes. There's some tricks that you have to learn there that you can't do from the traditional side, like for example, taping an ankle, right? You use the white tape. Everyone knows you got your ankle tape. With performing arts, you have a costume. I can't use the white tape. So there are tricks that you have to learn in that sense. But it's the same exact idea, right? We're teaching them how to stretch, how to mentally prepare, do our box breathing, everything that you do to prepare for an event. It's the same thing as preparing for a performance. We actually have one person that's working with an academy. So we are in the public safety space. So I know there were stories or there was an article out of Texas, and Kristen probably knows more about this than I do, but there was a fire department, the whole city fire department that hired an athletic trainer to cover all of their fire houses. So
mm,
someone would go there. And then along that same line, big companies like Google and Amazon are hiring athletic trainers, Coca-Cola distribution, where they come in more and they help out with more of the ergonomic side and helping the workers, in that case, I'll call them athletes as well, but helping the workers evaluate what is their technique in doing stuff. How can we prevent injury from happening further? And that's kind of the different settings that we're in. I'm just trying to think if I missed any: performing arts, public safety, military, um, and then the traditional schools, right? So everything that we learn in the school setting, everything that we've learned as far as how to be an athletic trainer on the sideline and in an athletic training room, you can take it to whatever setting you're in. One of the spaces that I'd like to see us more in is probably in the emergency room, where
Mm.
you do have parents that do bring athletes to the emergency room. And sometimes the doctors there are not as familiar as what we do on the sideline. They are getting more familiar. So don't get me wrong there, but they are getting more familiar. But I think with us in an emergency room setting, it kind of helps again with those orthopedic exams, right? Oh, you sprained your ankle. Here's what we can do. Well, the doctor will come see you after. So we can kind of help expedite orthopedic injuries as they come through.
That's interesting. I did not think about that aspect at all, about the orthopedic side. I think that's a really good idea, for a number of reasons. Like you talked about the parents not knowing and the MDs also not knowing. I think about all the sports shows I've watched where people are coming in from the ER and the parents are there, and the child or the athlete goes inside and the parents are freaking out in the waiting area. Just having someone to really explain to them what's going on, and to talk to the doctor about also what's going on, in the mechanism of injury and how those things kind of progress. I think that would be a great thing for ATs to be a part of for sure. So that's a great thing for sure. And I think the concept of big companies also using ATs for even ergonomic purposes, I didn't think about that either, because that is a great way to also not just talk about your employees being better and talk about wellness in the workspace, but also a great way to really showcase what ATs can do that is, again, across the spectrum of all fields. I think we all just think about sports when we talk about athletic training, but it really goes beyond that. And I'm realizing and doing more of these shows with ATs, you guys do so many more things than it's advertised, right? If you think about how the media advertises athletic trainers, it's really about a field, basketball court, whatever, and that's it. But there are so many more things that really come to what ATs are doing. So I'm glad you guys are sharing those things now. Roy, what are some of the challenges you see in across the spectrum? Because again, you guys are expanding and doing so many things abroad now. But are there any challenges that you're seeing in terms of where ATs can be more effective, or some of the issues that people think you guys do but you don't, or that you don't do that they think you do?
So for me, it's kind of a two-folded question, right? So as far as what can the public understand as far as what athletic trainers do, I think we do a pretty good job of educating. I mean, we are a younger profession, and when it comes to allied health, right, we're not as I guess we're not as long as in nursing or in PT and stuff like that. So athletic training is kind of new, and a lot of people just get the exposure of athletic training through watching it on TV, right? So seeing, especially in professional sports, and sometimes at the Power Five school level, they don't really understand. So the resources that they have at those levels are kind of different what we have at the secondary school level. So a lot of times they ask what modalities you have, and this is it, right? These are only modalities we have. We don't
Right.
have STEM, we don't have ultrasound, stuff like that. So we have to use this. So understanding what an athletic trainer can do, also understanding what people can do at home, right? So the athletic trainer can see stuff, but you also have to do homework if you're in a secondary setting. So what are some of the things that can you take? I don't want to say, and I'm pretty sure you say this the same thing to your patients, Sean, right? So I want to see you 3 times a week, but on the other 2 days, you got to do something. You can't
Right.
just sit around in, right?
Yep.
So we want to do that. The biggest thing for me, since I became an athletic trainer, like I said, I've been doing it for about 20 years. I kind of fell into this cookie cutter approach of where every ACL was going to be the same program. Every UCL or Tommy John surgery was going to have the same program. So for me, going into kind of volunteerism and advocacy was
Mm-hmm.
kind of my growth as an athletic trainer. We went to school for so many years, and Sophia is just recently out of it, but we went to school for so many years to earn the title of athletic trainer. So why can't we share that? Why are people still calling us trainer? Why are people
Mm.
still calling us, hey guy, right?
Mm.
And the other part of it too is I want to make sure that we are, it was mentioned earlier, we're part of a team and a sports medicine team, whereas we are probably the one that will see the athlete on a daily outside of the coach and the parents, but we'll see them on the daily. And then we would communicate with the doctor and the physical therapist if we send them out that way, or the sports psychologist or the nutritionist, in ways that, we put this whole team together so that at the end of the day, we're here for the health and well-being of all the patients that we talk to and that we work with.
Yeah, yeah, definitely a cultural shift. I think the more you talk about it, educate others on it, it will continue to move. I mean, like you said, nursing, the PT route, I'm still telling people about what I do. They're still thinking that, we walk people in the hospital and we clean up when they go to the bathroom. And, there are certain just things that are ingrained in how we think and how people were taught certain things. But the more we just talk about it, educate more about it, the more that will change. It happened for the MDs, it happened for the nurses, it's happening for the PTs, even for the OTs, it's happening for the ATs too. So we keep pushing, we keep sharing. And Kristen, I'm curious now. We talked about so many things that ATs do across the spectrum, and we're all part of JAG. I believe one of the, if not the best PT company in the Northeast. And we have this amazing AT program. What makes this program different compared to other AT programs across the Northeast and across the country? What are your thoughts on our JAG physical therapy athletic training program?
Yeah, I think one thing in particular that I'd say I liked about JAG, so let's even forget just, the AT program, but the company in itself is almost how true they are to our values. So JAG, we are in the New York, New Jersey, Pennsylvania area. We are truly in that New York metropolitan area. And I think that really speaks to just, like the population that we're in and kind of just the culture of what we are looking for. So I think that was one thing that was very attractive, that we have our roots, we're sticking with them, and we want to be able to best serve the people in this area. That, of course, translates over to athletic training, and that we have the same aspects. The Northeast is actually a really great area for athletic training. New Jersey actually has the highest fill rate of athletic trainers across the whole country. So 92% of public high schools in New Jersey actually have athletic trainers, where the country's average is only about 30%. So New Jersey does a fantastic job of having athletic trainers and, athletic training advocacy. So being with a company that likes to do the same thing, advocate for athletic trainers, making sure we supply athletic trainers to schools has been something that's really awesome. I think one thing that I particularly liked about athletic training and what we have going on here is that we have a really diverse team. So we have about 17 athletic trainers, all different sites, as we mentioned, secondary schools, colleges, professionals, industrial, administrative, whatever it might be. So in our own company, we kind of have our own, our own fishbowl of, hey, we have everybody here, even though it's on a smaller scale, different settings, different opportunities. And even with that, different experiences. Even though each of these employees were working at a different site, they've all had so many different experiences that kind of brings us all together to make ourselves a really strong team with the past experiences, bringing it together. One thing we also do well here, I think, in the athletic training program and in our company is continuing education. So that's something that we are all very familiar with. JAG is really great at putting together continuing education events, whether it's for athletic trainers, physical therapists, occupational therapists, whatever it might be. We have our clinical lecture series at 8 o'clock at night, so people can make it. We have things in the morning. We have, opportunities for growth throughout the day. So having those opportunities with all the healthcare professions is really great. Most of the time, those opportunities aren't just offered to one domain versus the other. It's typically, hey, athletic trainers, PTs, and OTs, everybody come and learn. So we're all kind of put on that even playing field of, okay, here's a topic. Let's all learn together from it. How can we take the strengths from each other, the strengths from our professions, and kind of learn from what we can do here to make ourselves a really good, and cohesive unit so we can best treat our patient. Because when it comes down to it, that's the goal of all these professions, right? Athletic trainers, maybe we see athletes and younger guys a little more. OTs, maybe we're on a little bit of the older side. But regardless, our goal is how can we best treat our athletes? How can we best learn the current practices, current rehabilitation methods, whatever it might be, in order to kind of best hit, the goals for our patients and for our company. A company is only as good as its employees. So it's really good that we are definitely investing in our employees to kind of get the best outcome we can for our patients.
Yeah, I love the fact that you love the way JAG is treating you.
Yeah, it's good.
I think we're in a time now where a lot of employees are not happy with where they're working, right? There are a lot of employers are like, it's a job, I work there, it is what it is. But every time I bring on people who are talking about JAG, they're always talking about how they love the environment, how they feel seen, how they feel heard, how they feel appreciated, how they love what they're doing, and how there's a space for them to do what they're doing the way they want to do it. And I'm just really impressed because that is how I also feel, clearly.
Yeah.
But it also means that it helps us to serve our clients, our patients, our staff members, our athletes better. Because if
Right.
we're happy, then they're going to also be happy with our services. So,
Yeah.
have you seen any differences? I mean, you've been everywhere, Northeast, you've been down south, in terms of all the spectrums that you are serving as an AT. Do you think there's any difference between people who know about ATs in the North versus the ATs in the South? Is there any kind of discrepancy between them knowing what you guys actually do as opposed to asking more questions, North versus South, or is it the same kind of awareness wherever you've been in the last couple of years?
Yeah. I think honestly, it depends. A lot of my experience was in Texas and in New Jersey, and honestly, those are two really great places for athletic training. So I think in both locations, the presence of athletic training was pretty strong, and that does help translate over when you are trying to advocate for your profession and honestly for your athletes when it comes to coaches and parents as well. So I would say the visibility of athletic training is pretty great there. I think one difference is sometimes when we look at athletes and just the way that different cultures in other areas of the country operate is maybe some more surface level things. So, sometimes we'll say, for example, in the South, the way that they might operate their teams and their practice might be a little bit different. For example, things, were a little bit slower down there. A lot of times, teams would pray before practice and it'd be a little bit different of, there was no cursing as much, right? So some of those surface level things, maybe that was a little bit different on that aspect. Up here we move a little bit quicker. Coaches are a little bit quicker. We're a little bit louder, as we say. But when it comes down to it, I think in both areas of the country and really across the country, both, everyone's just using sports as a vessel when it comes down to it. 99.9% of the population that's playing a sport is not going to the NFL. We're not going to professional soccer league. We are kind of using sports as a way to connect with others, get physically active, and teach good life rules about ourselves. So I think the cultural difference of the way that we treat sports might be a little bit different. But again, the purpose of it, the way that athletic trainers and athletes use sports again as that vessel for self-betterment, communication, even community is kind of all the same in that aspect.
Yeah, yeah. I was just thinking about all the Friday Night Lights and all those other, big time shows that really highlight the athletic trainers literally on the side and just like they're the coach, they're the mom, they're the dad, they're
Right.
everything, right? And
Yep.
yes, like you said, people are sitting there praying before games and it's a
Mhm.
whole thing. And
Right.
we don't really have that up here in the North, but we have, like you said, like Roy said, we're talking about, ATs being in the workplace, going to Amazon, going to Google and working on ergonomics. I'm sure that's not happening maybe in the South as much because so it all depends on what's happening where you're going. But you guys really span so many different fields.
Right.
And Stephanie, I'm looking to you now as the director in chief of this whole operation. You've been doing a great job to really um, expand the AT program in the last couple of years. I've seen your work. I've seen your hard efforts to get this thing done, and your team has grown so tremendously. I'm curious now, as this theme for this year is champions in healthcare. Um, there's so many who are now a part of this team, right? You have those who are new to the profession, and then you got Roy who's been doing this for a number of years now. What's the charge that you give to your team when it comes to still being champions in healthcare? Especially when, you know, January is a good month and March is here, so we're still in it. But as the years go on and as the time goes on, sometimes we get jaded, sometimes we get tired, we get fatigued. The energy to really put your best effort for your clients, for your staff, kind of diminishes. So what's your charge to your team when it comes to being the best AT that they can be?
Yeah, no, I mean, that's a great question. And thank you for the praise. Again, I'm so excited to see this team, continually growing over the years. And like I said, it doesn't stop there. We need to stay focused, right? So, I think, being a champion in healthcare will mean different things to different people. But, I like to encourage our team, to focus not only on providing like the top tier care to our athletes and those communities that we serve, but kind of what we discussed today, just continuing to serve as advocates, for the overall well-being of everyone that we serve and for ourselves. A charge that I would give the team is I want them to continue to lead with, empathy and knowledge and, dedication to this craft of athletic training that we're practicing, each and every day. We need to be champions, not just on the field, but also in our approach to the way that we prevent and educate and help our athletes recover. I want our team to really help foster that culture where every athlete knows that they're supported and where our staff really feels empowered to elevate that standard of care. Whether it's staying on top of the latest treatment protocols and providing education, which I know we've discussed on this podcast today, also focusing on mental health and advocating for that injury prevention. Each of us will continue to play that key role in being that champion for ourselves and our athletes, our athletes' health and safety.
Amazing, amazing. And what's next, Steph? I mean, ATs are doing so many things across the spectrum now. You guys are in all facets of not just athletics, but workplace environment, mental health, wellness. You're doing so many things. What's next, you think, for the ATs across the spectrum when it comes to career growth and development of this profession?
Yeah, I mean, Roy brought up a good point before. I think the next thing is to stop saying emerging settings, and think of a new term because we're fully in these settings, right? We have been seen throughout these quote unquote traditional settings for all of these years, but we're fully in these new areas that maybe we never thought we would be in. So since the role of athletic trainers is really expanding beyond that traditional setting, not just where we're operating, but the education we're receiving now too. A master's degree is required to become a certified athletic trainer now. So I think between the education that we're receiving and the settings that we're having the opportunities to work in, I think you're just going to see athletic trainers, further integrating into healthcare systems and elsewhere. We're going to keep providing that very comprehensive care alongside other clinicians and physicians. But that's really been made possible by the additional education that, we've been given and required to take, but also the diverse, settings we've been exposed to. I think we touched on this a lot today, as you did just now, but, some of these other areas that we're really focusing on more is mental health support, not just the support, but recognizing the connection between mental health, well-being, and injury risk. We're expanding our role into those, ergonomic areas where we're educating, not just athletes, but those to, in the office setting, let's say, because really aiming to prevent those common injuries, in these settings. But I think, all in all, we're going to continue to really refine injury prevention and management strategies because we really do see things from start to finish as athletic trainers. So, not only applying those principles to sports, but in these other environments that, we're continuing to be exposed to. So, the future is bright. We have a ton of opportunities as athletic trainers now, and that's because of everything that we've done, over these years to advocate for the profession, and share with the communities everything that we're able to do. So I think as ATs, everyone on this call, including myself, we just have to continue to stay adaptable, continue to learn and really refine how we contribute to the physical and mental well-being of athletes and all of the communities that we serve.
That's powerful. My final question for each of you, and I'll give you each about 2 minutes to answer. What is the one thing, as we celebrate AT month, what's the one thing you love about being an athletic trainer? And what's the one thing you want to do more this year to connect with your demographic? So whether it's high school, middle school, whatever your demographic is, the one thing you love most about being an AT and the one thing you want to do more to connect with your demographic. I'm going to start with you, Sophia. Yes. What is your answer?
Just as Steph just mentioned before, is we have the opportunity to be with them before they're hurt. When they get hurt, to help them out. And then afterwards, being able to return an athlete back to play is amazing. They're back to 100% normal. Throughout that entire process, you develop trust with this person, a relationship. And it's fun, you make PT a little bit more enjoyable. Back at our clinic, we have the riddle board. I know a lot of clinics have some question or a riddle that athletes or patients can come in and answer, right? And just seeing them interact in our space and feeling comfortable and positive, and kids will just come by to contribute to the riddle board. Right now we have a scoreboard going on. So it's just awesome being able to have a positive environment where people are coming because they're injured. It's the first time we meet people sometimes.
Hmm.
So it's just cool being able to be with them the entire time throughout that process. Very
Yeah.
grateful.
And what do you want to do more to connect with them this year?
I think being able to have those conversations, it's getting a little bit easier. In addition with like mental health, right? Including that resource. At our school at NJCU, we have a counselor that we're able to contact and kind of connect these kids with, and that's rare. So being able to discuss that more with athletes more often, I think is something that's more important and I want to try to work towards throughout the year.
Perfect, perfect.
Mhm.
Amanda?
Um, Being here for so long in this school district too, I love the fact that as a middle school, high school, I'll see some of these athletes for 6 years. So the fact that you get to see them grow in sport and as a person is an amazing experience. And because it's such a small school district, I tend to know families throughout the years I've been here, to the point that some of them almost become family friends after they graduate, that it is a fantastic experience to have. And then something I want to work more on is probably, like I said, the mental health aspect of everything. Is I know we're always running a mile a minute and we're all over the place, especially if we're the only athletic trainer in our setting. But to really sit down and have that small conversation when there is an injury of how are you handling this? Is there anything blocking what's moving you forward? And just trying to communicate a little bit more with them, I think is definitely something I want to try to add to this year.
Sounds good. Roy, you're up.
So, to be honest with you, I got into athletic training because I heard it was the best seat in the whole stadium. So being on the sideline was the number one reason, and also traveling around. So, I was able to travel throughout the country to places I never thought I would go to. I've been to Ecuador with the team for 3 weeks. So those are the kind of things that I looked forward to when I was first starting out as an athletic trainer. But I think, Sophia hit it right on the head. Watching the athlete go through the progression from a season ending injury all the way to their return. And for me, on a baseball kid with a UCL or a Tommy John, them striking out the first guy they see. That's kind of, and then they point to you in the dugout, like, yeah, I helped you do that. So, those are kind of the rewards that we look for and everything else. Um, so yeah, travel, best seat in the house, and the reward of seeing the kid come back. For me, what I'd like to see, I think educating the community that I'm in, especially in the Bronx where I'm at, where a lot of people don't really understand injuries as much or as others do. I think we're a little bit different in our generation because parents that have kids now and that are parents now have probably had an athletic trainer when they were an athlete, so they're a little bit more familiar with what athletic trainers do. So having the athletic trainer in the institution just gives them more reassurance that we are able to do more. So the next part is, how do we bring our services to the community? And some of the things that we can do is hold tabling events to show this is what else we can do. Sometimes food insecurity might be a topic at your institution. So you can go ahead and, hey, let's do a nutrition talk. Let's do a hands-on snacking kind of day thing, right? That's one part. The other part I'd like to see is, I'd love athletic trainers to sell their brand better, right? We are seen behind the scenes. We are good behind the scenes. We don't look for those accolades. Well, I mean, I do a lot, but a lot of people don't look for that recognition or that pat on the back. But I would love for them to kind of sell their brand a little bit better and kind of say, hey, I'm here. I'm the athletic trainer. This is what I do. This is what I can do. This is what I did. And kind of show people that we can be an essential benefit to their institution and their programs. So not only in a school and traditional setting, but also bring it out to the community, to club sports, to AAUs, to Pop Warner, stuff like that.
Yeah, thank you for sharing. Kristen?
Yeah, I think one thing, I think all of us kind of have a general theme here where, the one of the best parts of it is really just connecting with other people and seeing them get back and better. So I'm kind of on the same thing. I think in particular, again, I kind of mentioned before, I really see sports as more of a vessel, right? Like we're here to, again, build community, build relationships. And I think the same thing is done on the athletic training aspect. Getting injured as an athlete is a very tough and an identity crisis, kind of as Sophia mentioned before. So I think it's really important to make sure there is a designated person who is there to kind of be with the athlete through almost every phase. I mean, one thing I love about athletic training is that you are there with the kids before they get injured. So, preseason, that tough strength conditioning, you're there when they unfortunately and probably inevitably do get injured. We're there through the rehab and then they return to sport. So you're really there with them through every single aspect of the injury process. I think it's a really rewarding thing and really not something that I don't think any other profession can really say that they have every step in the injury process they have a direct hand in. So I think that's something that's really special about athletic training. And one thing that comes with all of that is, of course, the emotional aspect of it. Throughout that injury process, there's going to be a ton of ups, tons of downs. And that's something you're always kind of working through with that person. And it can make you really close with, some of your athletes and everything like that. I'm still pretty close to some of my athletes from Texas. It's pretty cool when they'll shoot me a text and say, "Oh, hey, I just graduated college. Thanks so much." And it's like, man, where's the time gone? I saw you when you were a sophomore. Now you're graduating college and you played all 4 years. And, they're kind of saying, "Oh, hey, because of you, I was able to really connect with my college athletic trainer. Still love you the best." We'll take that aside. But it is really cool just to be able to see them grow and foster as a person. So that's probably my favorite thing there. I think one thing that I'm looking forward to doing is kind of just getting a little bit more involved, I guess, in the athletic training and athletics community in New Jersey. It was really great making all my relationships in some other states, but to a point, you kind of have to start over and make all those ones again. So, looking forward to doing that in this area. I think, especially with the company and with the network that we have, it's been good. But looking forward to continuing to do that for myself.
Mm-hmm. Thank you so much. And I really I appreciate you sharing the connection, being with them through the process. I think when I
Mm-hmm.
got hurt, I didn't have an AT who was with me. I had a physical therapist who was with me.
Mm-hmm.
And I think maybe that's why I became a physical therapist myself, because
Yep.
that was my
Yep.
connection. But we only had like one or two ATs at school when I got
Yeah.
hurt, and we had so many different teams or whatever else. So
Right.
I didn't have that connection with my trainer, but my PT was my connection. So that
Mm-hmm.
makes a difference. It makes a
Mm-hmm.
difference for sure.
Definitely.
And last but not least, Stephanie.
Yeah, I mean, speaking to where I currently sit as an athletic trainer right now, I work more on a per diem basis, so I'm not getting that opportunity to see the injuries from start to finish as I used to. So I think, where I sit now, something I've really, really enjoyed is it's a really tight-knit community. Again, I'm also a New Jersey native, and this is where I started my career. We know it's not the largest state, but we do know that's where they employ the most ATs. But the people I've met along the way have been fantastic. I mean, the relationships I've made with other ATs in the profession is something I really, really value. Even to this day, I'm meeting new ATs, even New York, Pennsylvania. We went to school together. I don't know, we have these ties in so many different ways. So just the people I've met, as of recent too, you can't beat these relationships. I mean, we have a ton of opportunities to go to conventions, seminars. You're seeing the same people over and over again. Building these relationships again is something I really truly enjoy. I love working with, athletes still. I don't unfortunately have my own set of athletes to work with, which is why, again, I'm speaking to where I currently sit. But that is something I've really enjoyed, especially in the role, I'm in now. And on the same note, something I would look forward to doing more this year, which is something, we're really, doing in-house here at JAG with our team of athletic trainers is, bringing more awareness to these associations that athletic trainers are a part of and, what you can do as an AT sitting in one of those roles to, bring awareness to the community like we've been doing, but, other ways to advocate for the profession and, start new legislatures and, try to grow, what we're able to do in our practice. So I love to continue to become more aware of how to be involved in these areas, but, help our team, not just here at JAG, but, the other athletic trainers in the community, bring awareness to why that's so important, to be a part of those associations and organizations to, continue to help, grow the profession down the road.
Stephanie, if someone wants to join our team, whether they want to be a part of the AT team here, they're AT looking for a job or looking for AT services, how can they contact you?
Yeah, no, it's a great question. So anyone, yeah, again, and I'm glad you brought that up. Interested in being an athletic trainer with us, or using us for our athletic training services, because we do provide services again across this tri-state area. You can go to jagpt.com/athletic training. That just brings you to a general page where you can learn more about our program. Not only being an employee of our program, but utilizing our services. Or you can reach us at athletictraining@jagpt.com. If you just want to have a conversation with us, pick our brain about what we have to offer. Again, we have a really large, amazing team of athletic trainers here who are more than happy to do so. So that is where you can find, our leadership team and our department here.
Awesome. Any final thoughts you guys want to share before we close out?
I'll just say, one thing I'll say is stay tuned for all the awesome content that you will see, in the month of March, with the help of this team on this call and the rest of our outreach athletic training team. We're really excited to share, everything that we've pulled together for National Athletic Trainer Month, including, this series. So again, thank you, Sean, for having us and being able to, share the expertise with the community. So I just would love everyone to stay tuned for all the awesome content that JAG Athletic Training is going to be sharing during this month.
Awesome. Looking forward to it. Sophia, Amanda, Kristen, Roy, Stephanie, thank you guys so much for being guests on the show today. You made this one for the books, and I appreciate all of you. Happy AT months, each of you. Keep pushing, keep doing what you're doing, keep educating, keep inspiring. And I salute you all for your special month. So congratulations. And for those who are listening, of course, follow JAG PT for all things AT related. Our team is amazing here. They've been doing some great work in the community and will continue to do so until who knows when. So be a part of that program with us and continue to be a part of our Be More Today family. We'll be here next week with another episode of Be More Today show. But until then, continue to be more alive in 2025, and we'll see you guys soon. Peace.